Senate Republicans and Democrats are praising state health officials' requests to expand access to drugs that reverse opioid overdose, especially among heroin users.
This will save lives, and to me it's analogous to a lifeguard at the beach. If somebody's out there drowning, we don't ask how they got in that situation. We just go out there and save them, and then we try to help them from there. But if we don't save them, then we don't have a chance to help them.
Senate Bill 734 would allow pharmacists statewide to dispense anti-overdose medication to private citizens who themselves may be subject to overdose or are in a position to help someone else who has OD. State health officials tell lawmakers some recent efforts to expand these medications to first responders has saved lives, with more people surviving overdose than dying from them just last year.
In other states that have moved in this direction, sir, how long have they been doing this, and what sort of experiences have they seen in terms of a reduction potentially in deaths or at least the ability to intervene with those who have overdosed?
The idea of a standing order by the state health director giving that widespread of availability, we're still in the infancy of learning that. We know we take great encouragement from the fact that last year, because we have made Narcan so available to our first responders, that last year, for the first time ever, we had more people who were saved than actually died.
If Senate Bill 734 can become state law, state health officials could immediately issue a standing order to allow the legal distribution of anti-overdose drugs at every pharmacy in North Carolina. The legislation would also carry protections by granting immunity from civil lawsuits and criminal charges when private citizens administer these drugs.
I am thankful that for once the state has looked at public health as public health, and actually given authority to the state health director to initiate a reaction to an epidemic of statewide proportions. And I just want to say thanks.
Lawmakers heard that these overdose medications do pose some side effects, but the main side effect is if you OD and you need this medicine, you will die without it.